my time is very limited here. So clearly, definitely, unequivocally, you have studied vaccinated versus unvaccinated.
We have not studied vaccinated versus unvaccinated.
Oh, that was, okay, never mind. So just stop there. That was the meaning of my question. You wasted 2 minutes of my time. What steps has the CDC undertaken to ensure the integrity of the research that was performed by Dr. Thorsen, who, as you know, has been indicted for misconduct and misallocation of resources?
So Dr. Thorsen, who is a co-investigator on a couple of studies that came out on autism, was really just one investigator, and that body of evidence related to vaccines and autism.
All right. Have you gone back to validate the variety of studies he participated in? I mean, you know this guy is a humongous scumbag, one of the most wanted men on earth, and you relied upon him for data to determine whether thimerosal had a negative effect?
So two studies don't conclude a body of work. The body of work that's relating vaccines to autism is a large collection of studies.
I know, but you told me you only had 2 studies relating to vaccines, vaccinated and unvaccinated, so you must figure 2 studies must have some weight. In the course of answering this, one of the witnesses told me that the fugitive doctor had been involved in a couple studies with CDC, and I have information here that he was involved in 21 of the 24 studies. And I would like to submit that to the record, Mr. Chairman.
Without objection, so ordered.
Thank you.
Again, I'd like to...
What steps has the CDC undertaken to ensure the integrity of the research that was performed by Dr. Thorsen, who, as you know, has been indicted for misconduct and misallocation of resources?
So Dr. Thorsen, who is a co-investigator on a couple of studies that came out on autism, was really just one investigator, and that body of evidence related to vaccines and autism.
All right. Have you gone back to validate the variety of studies he participated in? I mean, you know this guy is a humongous scumbag, one of the most wanted men on earth, and you relied upon him for data to determine whether thimerosal had a negative effect?
So two studies don't conclude a body of work. The body of work that's relating vaccines to autism is a large collection of studies.
I know, but you told me you only had 2 studies relating to vaccines, vaccinated and unvaccinated, so you must figure 2 studies must have some weight. In the course of answering this, one of the witnesses told me that the fugitive doctor had been involved in a couple studies with CDC, and I have information here that he was involved in 21 of the 24 studies. And I would like to submit that to the record, Mr. Chairman.
Without objection, so ordered.
Thank you.
Again, I'd like to...
So I'm on the website here of Office of Inspector General, U.S. Department of Health and Human Services, the fugitive profiles. And if you scroll down, you get the fugitive that they're talking about, Poul Thorsen. From approximately February 2004 until February 2010, Poul Thorsen executed a scheme to steal grant money awarded by the Centers for Disease Control and Prevention, the CDC. The CDC had awarded grant money to Denmark for research involving infant disabilities, autism, genetic disorders, and fetal alcohol syndrome. CDC awarded the grant to fund studies of the relationship between autism and the exposure to vaccines. The relationship between cerebral palsy and infection during pregnancy, and the relationship between developmental outcomes and fetal alcohol exposure. Thorsen worked as a visiting scientist at CDC, Division of Birth Defects and Developmental Disabilities, before the grant was awarded. The initial grant was awarded to the Danish Medical Research Council. In approximately 2007, a second grant was awarded to the Danish Agency for Science, Technology and Innovation. Both agencies are governmental agencies in Denmark. The research was done by Aarhus University and Odense University Hospital in Denmark. Thorsen allegedly diverted over $1 million of the CDC grant money to his own personal bank account. Thorsen submitted fraudulent invoices on CDC letterhead to medical facilities assisting in the research for reimbursement of work allegedly covered by the grants. The invoices were addressed to Aarhus University and Saga Granska University Hospital. The fact that the invoices were on the CDC letterhead made it appear that CDC was requesting the money from Aarhus University and Saga Granska University Hospital, although the bank account listed on the invoices belonged to Thorsen. In April 2011, Thorsen was indicted on 22 counts of wire fraud and money laundering. According to bank account records, Thorsen purchased a home in Atlanta, a Harley-Davidson motorcycle, an Audi automobile, and a Honda SUV with funds that he received from the CDC grants. Thorsen is currently in Denmark and is awaiting extradition to the United States. You know, it breaks my heart that I have to do this here and do the mainstream media's role. You cannot get any information online about this man here or this story. The only articles that we can find regarding Poul Thorsen is on autistic websites. Complete media blackout. What is going on? Why does it take someone like me to have to expose this? This is one of the biggest stories of the 21st century, and the media is complicit. Now, this next video that I'm going to show you is Congressman Bill Posey again telling Congress about CDC whistleblower William Thompson. William Thompson is a CDC whistleblower, and in 2004 he was the co-author of a study examining the links between autism and vaccinations.
Chair recognizes the gentleman from Florida, Mr. Posey, for 5 minutes.
Thank you, Mr. Speaker. I rise today on matters of research and scientific integrity. To begin with, I am absolutely, resolutely pro-vaccine. Advancements in medical immunization have saved countless lives and greatly benefited public health. That being said, it's troubling to me that in a recent Senate hearing on childhood vaccinations, it was never mentioned that our government has paid out over $3 billion through a vaccine injury compensation program for children who have been injured by vaccinations. Regardless of the subject matter, parents making decisions about their children's health deserve to have the best information available to them. They should be able to count on federal agencies to tell them the truth. For these reasons, I bring the following matter to the House floor. In August 2014, Dr. William Thompson, a senior scientist at the Centers for Disease Control and Prevention, worked with a whistleblower attorney to provide my office with documents related to a 2004 CDC study that examined the possibility of a relationship between mumps, measles, rubella vaccines, and autism. In a statement released in August 2014, Dr. Thompson stated, "I regret that my co-authors and I omitted statistically significant information in our 2004 article published in the Journal of Pediatrics." End quote. Mr. Speaker, I respectfully request the following excerpts from the statement written by Dr. Thompson be entered into the record. Now quoting Dr. Thompson. "My primary job duties while working in the immunization safety branch from 2000 to 2006 were to lead or co-lead 3 major vaccine safety studies. The MADDSP-MMR Autism Cases Control Study was being carried out in response to the Wakefield Lancet study that suggested an association between the MMR vaccine and an autism-like health outcome. There were several major concerns among scientists and consumer advocates outside the CDC in the fall of 2000 regarding the execution of the Verstraeten study. One of the important goals that was determined up front in the spring of 2001 before any of these studies started was to have all 3 protocols vetted outside the CDC prior to the start of the analyses so that consumer advocates could not claim that we were presenting analyses that suited our own goals and biases. We hypothesized that if we found statistically significant effects at either 18 or 36-month thresholds, we would conclude that vaccinating children early with MMR vaccine could lead to autism-like characteristics or features. We all met and finalized the study protocol and analysis plan. The goal was to not deviate from the analysis plan to avoid the debacle that occurred with the Verstraeten thimerosal study published in Pediatrics in 03. At the September 5th meeting, we discussed in detail how to code race for both the sample and the birth certificate sample. At the bottom of Table 7, it also shows that for the non-birth certificate sample, the adjusted race effect statistical significance was huge. All the authors and I met and decided sometime between August and September 02 not to report any race effects for the paper. Sometime soon after the meeting, we decided to exclude reporting any race effects. The co-authors scheduled a meeting to destroy documents related to the study. The remaining 4 co-authors all met and brought a big garbage can into the meeting room and reviewed and went through all the hard copy documents that we had thought we should discard and put them in a huge garbage can. However, because I assumed it was illegal and would violate both FOIA and DOJ requests, I kept hard copies of all documents in my office, and I retained all associated computer files. I believe we intentionally withheld controversial findings from the final draft of the pediatrics paper. End of quote of the doctor. Mr. Speaker, I believe it's our duty to ensure that the documents Dr. Thompson provided are not ignored. Therefore, I will provide them to members of Congress and the House committees upon request. Considering the nature of the whistleblower's documents, as well as the involvement of the CDC, a hearing and a thorough investigation is warranted. So I ask, Mr. Speaker, I beg, I implore my colleagues on the appropriations committees to please take such action. Thank you, Mr. Speaker. I yield back.
So I've been doing some digging around online, and I found this petition to subpoena William Thompson, the CDC vaccine whistleblower. Now, as you can see here, this petition has roughly 3,000 signatures. We need another 2,000 signatures. So I'm going to leave a link below for everybody to sign this petition. We need to put the pressure on here. We need this William Thompson in front of Congress. And we need him answering some serious questions. We have to get to the bottom of this. Now, in August 2014, William Thompson released a statement. And on this petition, you can get the statement. I'm going to read a little bit of it here. My name is William Thompson. I am a senior scientist with the Center for Disease Control and Prevention, where I have worked since 1998. I regret that my co-authors and I omitted statistically significant information in our 2004 article published in the Journal of Pediatrics. The omitted data suggested that African American males who received the MMR vaccine before age 36 months were at increased risk for autism. Decisions were made regarding which findings to report after the data were collected, and I believe that the final study protocol was not followed. I am providing information to Congressman William Posey, and of course will continue to cooperate with Congress. I have also offered to assist with reanalysis of the study data or development of further studies. So here you go. This man, William Thompson, wants to testify in front of Congress. We have to put the pressure on here. We have to get him in front of Congress, and we need to ask him some serious questions. So this final clip here that I'm going to play is from a lady called Stephanie Seneff, and she's the senior research scientist at MIT, the Massachusetts Institute of Technology. And she says half of all children will be autistic by 25. So I'm just ramming this home here that we need to do something, and quick. So please sign the petition below. Let's put the pressure on Congress here to subpoena William Thompson.
This is I'm Stephanie Seneff. I'm from MIT, CSAIL, senior research scientist there, and I'm going to be talking about the role of aluminum and glyphosate, synergistic role in autism. So you all know this frightening trend. This is autism diagnoses by the CDC. It's going up and up and up. Where is it going in the future? I predict by 2025, half the kids born will be diagnosed with autism. That's not going to be an easy situation for the country to face and for the country's future. I predict by 2025, half the kids born will be diagnosed with autism. That's not going to be an easy situation for the country to face and for the country's future.